So you have learned to interpret arterial blood gases or ABGs, but what do they mean? Here's a quick breakdown of why each acid-base imbalance occurs, what it tells us is going on in the body, and interventions to correct the imbalance. Metabolic acidosis is identified when the pH and bicarbonate are both low. This can happen for two reasons. The first is that a loss of bicarbonate, which is a base, happens because of diarrhea or diuretics. Think below the waist, base. This leaves the patient without enough base to balance out the acid, and acidosis occurs. The second reason is an excessive accumulation of acid from either lactic acidosis, diabetic ketoacidosis, kidney failure, or starvation. This patient could have a headache, confusion, and increased respiratory rate and depth to compensate. They could go into shock if their pH drops below 7. Treatment is to address the underlying cause, follow potassium levels closely, and evaluate the patient for dialysis. Metabolic alkalosis occurs when the pH and bicarbonate are both high. It can be caused by the loss of potassium or vomiting. For alkalosis, think above the waist, adios acid. The patient has too much base. Clinical manifestations include hypocalcemia symptoms such as Trousseau and Chauvet signs, a slow respiratory rate to compensate, and kidneys that are trying to excrete more bicarbonate if able. Treatment is to correct the underlying cause, providing IV fluids and potassium for hypokalemia. Respiratory acidosis occurs from a low pH and high carbon dioxide, or CO2, caused by inadequate excretion of it. The body retains CO2, which can happen due to pulmonary issues, hypoventilation, or an overdose of sedatives. Manifestations include changes in mental status and hyperkalemia. If this is more of a chronic process due to a lung condition, the patient may be asymptomatic. Treatment includes reversal of sedative medications, intubation, bi-level positive airway pressure or BiPAP, and hydration. Respiratory alkalosis is a high pH with a low CO2, and it can be caused by hyperventilation from processes such as anxiety, hypoxemia, early sepsis, labor, hepatic insufficiency, and cerebral tumors. This patient may feel lightheaded and or have a change in mental status, tachycardia, and arrhythmias. This is the condition that leads people to breathe into paper bags to try to rebreathe their exhaled CO2. ABGs can tell us so much about what's going on with the body on a cellular level. This can help guide treatments and prevention efforts.